Hello and welcome to Healthline 3. I'm Terry Simmons. Today we're talking about cancer of the head and neck, and we're talking with Dr. Sanford Katz, Assistant Director of Radiation Oncology with Willis Knighton Cancer Center. We'll be taking your calls throughout the show, and as a reminder, please make sure you're in a quiet room with your TV turned down all the way before making your call. The number is 318-219-4569, and we look forward to hearing from you to talk about head and neck cancer. Dr. Katz, thank you for being here.
My pleasure. Thanks for having me.
We're really looking forward to this. We were talking on the break or earlier in the show for the little tease before we closed the show. Fascinated about the ways that you can diagnose head and neck cancer. We'll go ahead and review again in case someone missed that. What exactly, let's be specific about what head and neck cancer really does include.
So what we're talking about is pretty much everything from the lips down to your voice box. So the front of your mouth, including the lips, is considered the oral cavity. And there are certain types of cancers that can occur in the oral cavity. Different things can cause cancers of the oral cavity. Then as we move back towards the back of the tongue and the tonsil area and the soft palate, that's considered the oropharynx. So that's the back of your mouth. And those cancers can be very specific and different from the ones that we get in the front of the mouth. And then you go further back, and now you're talking about an area called the pharynx. And that's really the beginning of the area where the food goes down and goes down into the esophagus and you swallow. And then the front portion goes down into the breathing portion of your throat, and that's called the larynx. And then the bottom of that is the vocal cords. And that then goes down into the lungs. So it's a very complicated area in terms of anatomy, because you have to speak, swallow, and breathe all in the same tube, and make sure that the food and the air go in the proper place. And so the anatomy is tricky, and the type of cancers that can occur in those regions can affect all of those three functions: breathing, speaking, and swallowing. So it's a very interesting area to treat, and that's an area that I specialize in cancers of the head and neck.
This is fascinating, just this little bit that you just explained, and thank you for laying that all out. I mean, it's no doubt why there's a need for a specialist, someone to specialize in this. You don't think about how many different types or different parts are in the head and neck, even just the mouth, the front of the mouth, back of the mouth. Can you get cancer of the gum? Can you get let's talk about the mouth, the oral cavity.
Sure.
What can happen? Let's start there with what can happen.
So the oral cavity, we're thinking, the lips, as you said, the gums, the floor of the mouth, the front of the tongue, the cheeks. Cancers that occur in those areas typically are associated with tobacco. The worst being the chewing tobacco.
Really?
Oh my gosh, that is one of the worst things that you can do, is to chew tobacco. And
now you must see that a lot here, because I grew up with everybody having a dip or a chew.
Yeah.
It's either between their lip or in their jaw.
Yeah.
So,
It's I really hate to see that, because you can really get some devastatingly damaging cancers. And so when you're talking about cancers involving the front of your tongue or your jaw or your cheek, those are generally managed surgically. And now you're talking about something that surgery that can affect your function and your appearance, and that's permanent. So those are really bad cancers to have. And of course, smoking also can cause those cancers as well. So that's typically oral cavity cancers, and those are generally handled by surgeons. Sometimes we use radiation as well, but those are primarily surgical.
Okay.
There are three types of cancer treatment. Surgery being one, another one being chemotherapy, which is medicine, either given in the vein or taken by a pill, and radiation therapy, which is basically either X-ray type treatment or even proton type radiation treatment, which is very targeted and delivered to specific areas. And so depending upon where the cancer is in the head and neck, how advanced it is, the preferred treatment might be surgery, it might be radiation, it might be a combination of radiation and surgery, and might be chemotherapy and radiation. So it really depends upon where it is, how advanced it is, and also what are we trying to do? Are we trying to preserve someone's speech, their swallowing, things of that sort? So usually these cancers are managed with a multidisciplinary team, which means a whole number of physicians, the surgeons, the radiation oncologists, and the medical oncologists. Those are the ones who give the chemotherapy.
Oh, so interesting. And you do hear a lot about chemo and radiation, chemo or radiation, and I never understood how they're, how you decide if it's both or one or the other. Is it a decision that I get to make? And how that really works. But I do want to talk about a little something that you told me on the break, that when you go to medical school, you're not really taught about radiation and all of this. So tell me about your background real quick before you go into more, like how you got into this, why, and where you learned all this.
Yeah, it's true. In medical school, you really don't have any exposure to radiation oncology at all. And typically there's maybe one or no graduates who go into the field. So it's a pretty, it's a pretty small field. The way I got into it was when I was younger, lived near the National Cancer Institute. And in high school, I had an opportunity to work in the National Cancer Institute doing cancer research.
Wow.
Yeah, and that really gave me the bug. I really wanted to be a cancer doctor. So I specifically went to medical school to become a cancer doctor. And I didn't know what kind. So, I looked at surgical oncology, which is surgery for cancer, and medical oncology, which is the chemo doctors. And, radiation was just a perfect fit for me because there was a lot of physics, that you understand nuclear physics, and a lot of math, which I like. And also there's specific biology related to cancer and radiation. And then also there's the anatomy portion. You have to know the anatomy of the whole body because cancers can affect all different areas of the body, and radiation is often used in many of them. So for me, it was just a perfect fit.
Perfect fit. Well, we're certainly glad you decided to do it, and we're glad you're here in this area. It's really amazing to have this right here where we don't have to go outside of the Shreveport-Bossier area to have this done.
Yeah.
I'm sure so many people are so grateful to have this treatment right here at home.
Yeah,
right?
Absolutely. I'm not originally from here. I've been here for 23 years, but I'm from, as I said, from the Northeast.
Right.
And so, it's surprising how sophisticated and advanced the medical community is here in Shreveport, and that was one of the things that drew me from the East Coast. There is very little that you can't get treated in this area, and we do get people coming from more rural areas, and Shreveport is certainly a kind of a medical destination. But I mean, the care here is so sophisticated, and not just in cancer care, but in surgery and all other areas of medicine.
Yeah,
so
definitely.
We're really lucky.
We really are. We're really blessed to have it all here. And we talk, as you've mentioned, and other doctors that we have here on Healthline 3 that do talk about people not only in rural areas come here, but from far away. People will come here. It has become a really good destination point for people to get treated for certain ailments, and not only cancer, like you said.
Absolutely.
So I'm going to ask you a real remedial question, for an obvious one. Chemotherapy and radiation, we hear about both of them,
Yep.
or either or with certain type of cancer. So what is the difference? Like, what does chemotherapy do and what does radiation do? How do those each things affect the body?
Right.
And why do they do what they do to help cure cancer?
Yeah. So I'm going to speak specifically about head and neck cancer because it is a little different depending upon the type of cancer and where it is in the body. Mm-hmm. But the way that chemotherapy is used, since it is a systemic treatment, goes throughout the body. If someone unfortunately has cancer that is spread beyond the confines of just the head and neck region, and it's in other parts of the body, the chemotherapy then becomes primary. So we have to treat the entire body, all the cancer cells that you can see and you can't see. And so in that situation, you need a systemic therapy, which chemotherapy is, and it becomes your mainstay. When we're talking about more localized head and neck cancer, what we're trying to do is we're trying to cure the cancer, and we're also trying to preserve function. And as I said earlier, when you have surgery, you alter the anatomy and you can alter the function. And so we often will use radiation as the primary therapy to cure the cancer and preserve the anatomy. So you preserve your function. The chemotherapy in that setting it's helpful. It's added to the radiation in a lower dose typically. And its purpose is to kind of sensitize the cancer cells to the damaging effects of the radiation, makes the radiation work better.
Oh.
Yeah.
I never thought about how they work hand in hand like that.
Yeah, so they work in conjunction. So that's why it's, we talk about a multidisciplinary approach. and that's where the medical oncologists and the radiation oncologists and the surgeons all come together. And I work with oral surgeons, oral maxillofacial surgeons, and ear, nose, and throat surgeons as well, and I have a number of medical oncology colleagues that we work with. So many times we get together and we have a meeting, and we talk about people's cases, and we try to come up with the best treatment options. And when I say options, it's because the patient often will have a say. I mean, they always have a say, but we present the advantages and disadvantages to maybe one treatment or another. And depending upon what is important to them and what they value the most, they may opt for one treatment over another. But typically when we talk about radiation therapy and chemotherapy together in head and neck cancer, we're talking about preservation of function. So we're talking about maintaining your voice, maintaining your swallowing, maintaining your tongue, okay? Sometimes that may not be feasible and you may need surgery, but then radiation sometimes is used after surgery, and sometimes chemotherapy and radiation together are used after surgery if there's concern that there might be some cancer cells left behind.
Okay. And is this the same thing? Preservation therapy is a term, is something.
We call it organ preservation.
Organ preservation therapy. So what is that?
Yeah, so organ preservation is, again, it's where you want to preserve somebody's anatomy so that it continues to function. So if you were to have, let's say, a cancer of your voice box, your vocal cords, and surgery would result in you losing your vocal cords, not speaking, and having a tracheostomy, breathing through, and some people, I'm sure, have seen that, where people breathe through their neck. So we often would want to preserve somebody's ability to speak, and so using radiation and sometimes chemotherapy together to get rid of the cancer, and yet they preserve their vocal cords and they're still able to speak. So that's considered organ preservation.
Okay, I get that. And so you mentioned that there are different types of cancer for different parts of the head and neck, right? So what, you want to describe those or talk about those?
Yeah, sure. So I've already mentioned the ones in the oral cavity, which can affect the jaw and the tongue and the cheek. As we get further back, then we get into the areas around the back of the tongue and the tonsillar region. And those are really special because, first off, they're very difficult to operate on. Okay, so oftentimes if you have to take someone's tongue, particularly the back of the tongue, they're not able to swallow, they're not able to preserve their airway. So food goes down their airway, and so oftentimes you operate on the back of the tongue. Many times you end up not being able to breathe and swallow in the same tube, so you need the tray. So that's an area that we use radiation as primary therapy. But what is particularly interesting is that we're finding more and more that cancers that develop in the back of the tongue and the tonsillar area are associated with HPV, or the human papillomavirus.
Yes.
And so and when I started my practice, it was usually smokers and drinkers, alcohol and tobacco. But now we're seeing the majority of people who develop those cancers, it's actually related exposure to a virus.
Wow.
Yeah.
And go ahead.
Yeah. And so what's very exciting about that, is people say, well, how do I prevent cancer? How do I prevent cancer? So there's a vaccine, which is the HPV vaccine. There's a couple different types, but it's now recommended that everyone get it. All children starting around the age between 9 and 11, boys and girls, get vaccinated to the HPV virus. And you can actually, it's recommended up to about age 26, although people up to about age 45 can derive some benefit. But the purpose of the vaccine is to immunize you against the virus. And that virus not only causes the cancers in the back of the throat, but primarily causes cervical cancer, as well as anal cancer.
Yeah.
So that vaccine is really important because we're finding a dramatic drop in the cases of head and neck cancers and cervical cancers in the people who have gotten the vaccine at a younger age.
Very interesting to know that. All right, we have a caller for you.
Oh, okay.
Hi,
great.
Abby. Thank you for calling. What's your question?
Okay, my question, actually, I'm a mother of 2 young girls, and just exactly what you're talking about is vaccines. My pediatrician did not offer he didn't say we needed the HPV vaccine, and I'm just wondering how important that is. Is it an optional vaccine, or should it be a required vaccine for my daughters?
Yes, I'm sorry, I missed the beginning. What was your name?
Abby.
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 Okay, hi, Abby. Yeah, that's an excellent question. So, there we are. That's an excellent question. It's kind of a sensitive topic because HPV is a sexually transmitted disease. And so many pediatricians are a little uncomfortable discussing preventing sexually transmitted diseases, when they're dealing with 9-year-olds and 11-year-olds, and it can be kind of touchy. So it is recommended. I mean, I think most people recommend it. I believe it's recommended by the American College of Pediatrics, as well as the American College of Gynecology and Obstetrics. But it is really an important vaccine, and the reason is because if you don't vaccinate your child, you're really making decisions for them later in life when they're in their 40s and 50s and 60s. We're all exposed to HPV during our lifetime. Most of us clear it, but some of us don't, and so there's really not much downside to giving the vaccine. It's well tolerated. It's been around for over 15 years. Millions of people have gotten this vaccine safely, and so if your pediatrician doesn't specifically mention it, you really should ask for it.
Okay, great. Thank you so much.
Thank you for
Very
your
helpful.
question, Abby.
And that's a really important call, because we don't hear that much about. For a while, when it first came out, when we were first made aware, we heard about it a lot.
Yes.
And so now for it to resurface again, I'm so glad Abby was watching, and any viewers with children, and you hear that, and you hear your doctor suggest it, but it's so informative to hear everything that it can prevent.
Yes.
Because you might just hear one specific thing, and that might not be the thing that you're worried about at that time.
Absolutely.
Or it is uncomfortable to talk about.
Absolutely.
But you never think about it being related to head and neck cancer.
Right. Head and neck cancer and primarily cervical cancer.
Yes.
That's how it came, it was developed.
Mm-hmm.
It was developed, and primarily it was given to girls initially to prevent cervical
Yes.
cancer. But then as it became known that this oral cavity, or I should say oropharyngeal cancer, was being caused more and more by the virus, then they said, okay, we need to give it to the boys too. And the girls can get the oropharyngeal cancers as well. But it not only prevents cancer, actually it can prevent various types of warts too, genital warts. So it's pretty important for a whole host of reasons.
Right.
Yeah.
And I'm sure we find out, and I'm sure there's always questions to everything with side effects of that too, but since we're talking about head and neck cancer,
Yeah.
we'll talk about that. But I'm sure that all of these play in together.
Yes.
And you do think about the risk and you ask about it, but to know that it prevents all of this stuff is really something to consider.
It is so important.
Yeah, so important. So let's talk about the symptoms of head and neck cancer. We kind of talked about a little bit about how even when you go to the dentist,
Yes.
and I didn't realize this too, so when they're feeling around on my gum and pressing, that's a screening that they're doing,
Absolutely.
right?
Yes,
I had
yes.
no idea that's what they were looking for.
For many people, it's the only screening they're going to get.
Yeah.
So the dentist is looking inside their mouth, they're seeing all those structures. Now, they're not getting down into the vocal cords,
Right.
but they're seeing the back of the tongue, and they're seeing the tonsillar region, they're seeing the whole front of the mouth. And so many times the dentist will find these things. Another very common way of knowing that you have something wrong is you get a lump in your neck, okay? And that's usually a lymph node that gets enlarged. And that tends to send people to the doctor. They go to the doctor, they go on antibiotics, and most of the lumps in people's necks are associated with an infection, a viral or a bacterial infection. It's not cancer, okay? But they go to the doctor, they get on antibiotics, maybe it doesn't get better, they get referred to an ear, nose, and throat surgeon or an oral surgeon, and then they get a CAT scan, they get a biopsy, and that's usually the first indication of cancer in the back of the mouth. Now, if you have a cancer lower down, let's say, involving your larynx, or the part that's involved in speaking, that can present a number of ways. Again, you can show up with a lymph node on the side of your neck, or you could develop hoarseness or sore throat or things of that sort, which is not getting better. It's not just a cold, it's not just a virus, and it's progressive. And so that can send you to the doctor, and the doctor evaluates you, sees that you have a cancer. And then that starts the process where you start getting a number of tests and biopsies and consultations with various doctors, and hopefully you start to get treatment that renders you cancer-free.
Right. And is there any, like the hoarseness or the sore throat is uncomfortable, is there any pain involved? Is it tender, this lump? How does it feel?
It can be.
Is it solid? Or?
Yeah. Well, sometimes it can be absolutely painless. And some people have no symptoms at all and all of a sudden just develop this lump in their neck. But sometimes it can be painful. And depending upon where it is, people can present with pain. Sometimes they get pain that's referred to their ear. And so, it doesn't have to be painful for you to have cancer.
It makes sense though, because it's all tied together. So any kind of symptom that lasts a while.
Exactly.
Yeah.
Exactly.
Okay. And go see your doctor right away and find out about that. And how does this cancer develop? Will you get a tumor on the larynx, or is it just something, a spot, something that grows? How does it develop?
Yeah, so it really depends. You know, you can have precancerous lesions, and sometimes people, they can have some hoarseness. They go to the doctor. It's not necessarily cancer. Sometimes they can have a benign cause of it, cause of their hoarseness, or they may have some precancerous lesions, and then over time that can develop into cancer. So, the main thing when we're talking about cancer is catching it early. Okay. And unfortunately, I see folks who don't catch it. They don't go to the doctor early, and it's pretty advanced when they come and see me. And the more advanced it is, the more aggressive the treatment needs to be.
Of course.
The more aggressive the treatment, the more side effects, and also, unfortunately, the more advanced the cancer, the lower the chance for cure. So pay attention to your body. When it's telling you there's something wrong, okay, you either don't feel right, you're having a sore throat that's not going away, your voice is getting hoarse, you have a lump in your neck, things of that sort, you need to pay attention to your body and go to your doctor.
It really is time for us all to stop and really listen right away to what's going on. Don't be afraid to call or go in and see and feel like it's silly. There is nothing silly. If you've been hoarse for a little while and you feel like it's just not, I think we all have that intuition. Even if you're hoarse for a little while, it's just not like you. That doesn't happen. Nothing really brought this in. Call your doctor.
Right.
Go find out. I would love to hear that you're being ridiculous. Go home. Oh, great.
No.
No problem.
It could be, and a lot of times it could be allergies.
Yes.
It doesn't have to be cancer.
But find out.
Sometimes what I encounter is that the reason why people don't go to their doctor is because they're afraid.
Yeah.
They don't want to hear,
They don't want to know.
God forbid, that it's cancer. They don't want to hear it. So they're afraid of the diagnosis, so they don't go and have it checked out. But then, unfortunately, eventually, they do end up at the doctor.
Right.
We want to catch it early. And that's true for cancers in all parts of the
everywhere,
body.
yeah, all over your body.
Yeah. And they're screening for all sorts of cancers, whether it be screening for lung cancer in smokers, or colonoscopies, and pap smears are very important, okay, because we are talking about the HPV virus. So preventative care is super important, because we don't want to end up at the cancer doctor's office.
Yeah, and now that you can catch it so early, why not? Just go find out.
Absolutely.
Which leads into my next question about people waiting too long, maybe for whatever reason, and certainly no shame or blame in that. You just have to do what you've got, if you feel right. You go when you feel like it, but this is what happens. What are the risks of head and neck cancer, of letting it go too long? We did talk about more severe treatments, but what are the risks of something just getting out of hand?
Well, unfortunately, if it gets out of hand, many times it's beyond our ability to control it. And then it can end up in other parts of your body. And once it does, unfortunately, typically it's not curable. So you get treatment to preserve your quality of life, to extend your life, but generally we're talking about an incurable situation when it's spread to other parts of your body. The more advanced it gets up here, the greater the chance of it going systemically. And if you have a more advanced cancer, then you're going to need more aggressive treatment, and you can end up with permanent dysfunction, even in the event that you have a good response. If the treatment is so aggressive that, particularly if you require surgery, many times you're going to have some sort of long-term, dysfunction of some sort, or even just a cosmetic, change in your cosmetic appearance. So, the earlier you catch it, the earlier you address it, the better off you're going to be.
Yeah, especially anything in the oral cavity you talked about. I mentioned that disfiguring of the face, the throat. There's all kinds of things that can happen. And let's talk about the spread of this cancer. Are there different pathways for different cancers, and where one might, if you get in the larynx, where it might go, or how does that work?
So typically what happens is you have a local spread, okay? So the tumor might get bigger and bigger and bigger. And then you're talking about regional spread, so it can spread to the lymph nodes. Now, when it spreads to the lymph nodes, people are like, oh my goodness, it's in the lymph nodes, that means, it's terminal. No. Spreading to the lymph nodes is a very common thing in head and neck cancer, and we see it all the time. In fact, it's unusual many times not to have spread to the lymph nodes, because that's the way that people present, okay? But eventually, if it's not addressed, or it's not cured, or presents too advanced, then it gets in the bloodstream, and then it travels to other parts of your body. And that's why chemotherapy, oftentimes given in the vein, it travels in the bloodstream, chasing the cancer, essentially.
Are there certain people that are, like, if there's people who, and do you test someone if they're going to be strong enough for chemotherapy, or some people who really just can't have chemotherapy? Is there ever a condition, and then do they have radiation, or what do you do with someone who just cannot
Right.
And they're not strong enough, or for whatever reason, they can't do chemotherapy.
Absolutely. So, I like to say we don't treat cancer, we treat people with cancer.
Oh, that's
and
great.
So the treatment is modified, or it is designed specifically for that particular patient. The treatment should not be worse than the disease, okay? And so what we want to do is we want to tailor a treatment that people can tolerate, that's not too toxic, and that they can get through. Because if you can't complete the treatment, you can't tolerate the treatment, then it's not going to help you. So sometimes we will scale back. Sometimes we'll omit the chemotherapy. Sometimes we'll choose one modality over the other. So that all kind of fits into it. Age, what we call performance status, how sick somebody is, nutritional status is very important. So that's all factored into our treatment plan. And a lot of this is relatively standard. In other words, we have national and international guidelines into how to treat these things. So, certain types of cancer, depending upon their stage, there's usually a couple choices of how you treat it, and then there's the preferred choice. But all of that has to be considered with respect to the patient and what they can tolerate. And that's where kind of the art of medicine comes in. That's personalized medicine. And not all chemotherapy, by the way, causes terrible side effects. We think of chemotherapy where people lose their hair and they get sick. There are different types of chemotherapy. And so the chemotherapy that's typically used when we're treating head and neck cancer is not the kind of chemotherapy that makes you lose your hair. And in terms of making you sick, we have very good medicines now that actually can help people from getting sick from that chemotherapy. With respect to radiation, unfortunately, it has its side effects too. And so one of the things that we do when someone is getting radiation is we see them on a regular basis, typically once a week, but we're available anytime someone might be having a problem, because they're coming for radiation typically every single day.
Wow.
So we're there. We're keeping an eye on them, and we're always available if they're having a problem. And so when we're talking about radiation to the head and neck, we're talking about typically an alteration in their saliva, so they can get a dry mouth. They can get a sore throat from the radiation. They can even get blisters from the radiation and some skin reactions. So one of the things that we try to do using our technology is we try to minimize the dose to those parts of the body and the head and neck and the throat that don't need the radiation. Okay? So if we can target that radiation very precisely, which we do, then we can minimize those side effects and help people get through it. And that's where the technology is really exciting. So if you can make your treatment more tolerable, then more people can get through it. You can actually intensify it and make it more effective. And so that's one of the most exciting aspects of radiation oncology, because we use just state-of-the-art technology, and we have physicists who help us, and we have we have nurses, we have technicians. It's a whole team approach. But we also have something called proton therapy, and that's really exciting too, because traditional radiation, I mentioned X-rays initially. X-rays are used for all sorts of things. We use them to take pictures, chest X-rays. That's because X-rays come in and then some of them go out because some of it gets absorbed. But that's a problem when we're talking about using high-energy X-rays to treat cancers, because we have to go through healthy tissue going in, and unfortunately, then we go through healthy tissues going out, and that's where some of the side effects come from. So when we use proton therapy, can't use that for taking pictures because it goes in, but there's no exit. And in fact, when it comes in, it doesn't even deliver much dose coming in, and then it delivers almost no dose coming out. The analogy I like to use is if you're playing pool, and you think of the proton as the cue ball, and you're breaking. So you break, and the cue ball pushes all the other balls away, and then it makes contact with the target ball and hits it in the pocket. So that's like proton therapy. So how do we know when to use proton therapy? Once again, it depends on the type of cancer, it depends on the patient, it depends on where it is, and so that's all part of the process of figuring out how to best treat somebody's cancer. But we're really focused on making it tolerable, decreasing the side effects so people can get through, and also giving them support. We have social workers, we have nutritionists, we have speech pathologists who help with people swallowing and speech, nurses, and so we approach this as a team, addressing people's needs from a psychosocial standpoint, as well as from economic standpoint if they need some help, as well as from a medical standpoint.
Very personalized.
Yeah.
Dr. Katz, I've learned so much. This is really wonderful. I think the biggest takeaway I'm going to have, and I hope our viewers are watching too about this, that there's different types of chemo, that you are really focused on being tolerable and taking care of the patient. Thank you so much for being here.
It's my pleasure.
I've learned so much. Oh, sure. I hope you come back again. Look forward to it.
I sure will.
Thanks for joining us today. Thanks for calling, and we'll see you on Healthline next time.